Okay, so Dr. Buford here. We're just getting started on the right knee. We've already harvested, hold the shaver again. We've already harvested a bunch of bone marrow, and we're ready to do that injection into the bone. But we wanted to take our first look inside and just show you what's going on. This is the medial compartment. And we can see here you've got a lot of degenerative changes in the femoral condyle up above. We can see evidence of the prior meniscectomy. Okay, so we're using our shaver here just to trim out the remaining part of this meniscus that's torn. Can you get a Raytech and put it around that, please? The other one too? Hey Preston, you got it around the cord also, so just put it right at the skin, under the cords. Yeah. And then, okay, so obviously I don't want to take any more meniscus than we have to. We'll take a biter, please. We'll keep working here, show you some more a little bit. An up biter? Yeah. Uh-huh. Yeah, I got you. No, yeah. Okay, so I think we're done with the meniscal work in this medial compartment. This is the most affected compartment. Let me go ahead and put the tourniquet up. And now we're going to go ahead and look at the anterior cruciate ligament. That's right here in the middle of the screen. That actually looks okay. In just a second, we'll go ahead and sneak over and look in the lateral compartment, which is right here. Keep it covered. Table down a little bit, please. Okay, and so now as we look in this lateral compartment, we can see you've pushed down on the knee if you can. We can see that you've got some cartilage damage here as well. We can see right here. We can see there's some loose cartilage here. I don't want to remove anything that we don't have to, but we can certainly see there's some loose cartilage there. Okay, push down with your right hand. Lift up on the ankle with your left. So with your left, reach down and lift up on that, down with the right. Awesome. Okay, and so that's a pretty good look there. I think that's all we need to see here. This helps us plan where we're going to place our intraosseous injections by seeing where the cartilage is the most affected. Pretty much you've got it on both sides, both in the femur and in the tibia. Okay, let's come on back. We're going to look at the patella next. And, okay, hold the leg straight. Yeah. And sure enough, you've got some patellofemoral disease as well. Okay, so here's the patella. This soft cartilage is right on the trochlea here. That's the groove that the patella normally glides in. But you can see that it looks like it's lost cartilage right in the central part of it for sure. We'll check over here in the medial gutter. I don't see any more loose pieces of cartilage or meniscus. This is the suprapatellar recess. And as we flush it out, it looks pretty clear. And then this is the lateral gutter. Same thing, that looks pretty clear. So I think we're done with the arthroscopic debridement. This is the patella at the top of the screen. Okay, I came back on the video because you had an interesting little tether that was tethering your patella, and we just debrided it so it's no longer connected. And so that may have been causing some symptoms as well. So I'm glad we had a chance to look arthroscopically here. We wouldn't have seen that had we not done this, because it was a soft tissue kind of bridge. And now that that's been released, the patella is much freer in its motion here, so I'm happy we did that. It was running basically right here. Okay, so now we're going to get to work on doing the intraosseous injection. We can kind of see exactly where we need to be. We can even come over here in the medial gutter and do it that way. So we'll show you some more in just a minute. Okay, you can see how we can use a spinal needle to localize the distal femur and even the joint surface. You can see as we come down here, there's the joint line, I should say. And we want to be proximal to that. And so somewhere about here is going to be a good starting spot as we pull back. Okay, you can see we've got our spinal needle just above the weight-bearing portion of the femoral condyle here. And we've entered approximately 1.5 centimeters. You can see the needle, we can even work it in pretty easily. Okay. And now we'll go off on the video for just a minute. Okay, so we just completed the intraosseous injection into the femur, right over this bare area, and now we're going to go into the tibia. Spinal. Pause, please. Okay, so we're about to do the femoral condyle on the lateral side. We're at the joint line, as you can see here. This is the lateral compartment. And there you can see the needle tip. Let me get you a better shot. There it is right there. So I can really adjust exactly how close I want to get to the joint line. There's the joint line. So we want to be just proximal to it, obviously, and angling away from the articular surface. That actually looks pretty good. Hold the camera. Okay, we're all done here. I just wanted to say goodbye on the video. We've actually injected the medial and lateral femoral condyle with 10 cc's each, and the medial and lateral tibial plateau with 9 to 10 cc's each of bone marrow concentrate. So good luck to you now. I really hope this does the trick. Of course, we also did a partial meniscectomy here on the medial side to remove some of those mechanical symptoms, I hope. But this will be the end of the video, okay? So good luck to you now. Bye-bye.